build a relationship with, because the SEPs, or when you can and cannot enroll, that should not be your worry. You should be able to call your insurance agent and let them know this is what's going on and this is what you need, and they are going to do the best that they can to come up with an SEP for you so that you can get the coverage that you need within the time frame that you need it. Go ahead with your second question.
Okay. Now, let me just speak to that. You're right. You
Hmm.
better trust your broker because the broker get paid for whoever he enroll them to, and brokers will try to get you into the plan that they get the most benefit from. Okay, I kind of found that
That's
out
going
over
to
the
be an
years. But let
independent.
me ask you.
So, Mr. Jesse, let's talk about that, because we don't want
Yeah.
to spread out bad
uh,
information. So that is partially right. There are some non integral insurance agents that will not make decisions that are not in the best interest.
Right.
Okay. People, and that's going to be coming from field agents, mostly independent field agents,
Mhm.
because they get paid commission. Now, I'm a licensed insurance agent, but I work for a company. So I get an hourly and I get a small commission on top of that. So
Right.
it's not my selling you or enrolling you into a plan, is it's not my bread and butter. Right, it's not the only way that I'll eat, but it's highly pressurable for individuals that are field agents. The second thing is, let's not focus, and I think that's what a lot of people do. They focus on the fact that an insurance agent gets paid to assist them, right? Well, that's their job, and everybody gets paid when they do their job. So it's not a bad thing for them to get paid, but it is a bad thing for them to, let's say you don't have any health issues, right? You rarely go to the doctor, you have 2 or 3 prescriptions. Do you really need a Medigap policy? And that's the reason why I'm here today. And hopefully, you guys will have me back. I'm here today to make sure that you understand exactly how Medicare works.
I can't stop God's blessings. No, they keep coming to me. I can't stop God's blessings. No, I just can't stop. I just can't stop. No, just can't stop. I just can't stop. No, no, no. I can't stop God's blessings. No, no, no. They keep coming to me. I can't stop God's blessings.
So that when anyone talks to you, you will be able to make an educated and informed decision for your own health needs.
I tell you what,
Yes, sir.
give Wanda your phone number because in October I will come to you. Okay, okay, and let you handle it because I had to deal with it on my own. I learned a lot about it because, I don't want to name the company, but I had
Uh-huh.
a group with them, and eventually they had to refund me. But anyway, I want to go to another point. Okay,
Okay.
but give Wanda your number. I'll be glad to call you. Have no problem. Look, how long
Okay,
you
sure.
been in this business?
11 years.
How many?
11.
11 years, you said?
Yes, sir.
7. I'm
11.
sorry.
11. 1 1. So the
11.
number
Okay,
after
that's okay.
10. Mm-hmm.
Now, okay. Now, well, I was going to ask, I thought maybe you was in it when the Affordable Care Act came
Okay.
out.
I
Okay.
was.
Well, let me tell you, the Affordable Care Act messed up everything. That's when it got real confusing. And I followed that. And the only one that legislator that I saw that came out that spoke on it truthfully was
Mm-hmm.
Jesse Jackson Jr. He
Mm-hmm.
came out. Came out first, and then
Mm-hmm.
he came out. But when when the Affordable Act came in, and they call it Obamacare, the insurance company cut a deal with them, and actually it was voted on with the Supreme Court,
Mhm.
and Roberts, even though it was unconstitutional, the Chief Justice Roberts came
Mhm.
out and said he voted for it because
Mhm.
it was, he said that Obama, that was
Mhm.
not the intent to his intent was to give Medicare to all, but
Mhm.
it messed up the whole structure of us getting, because he told us we could choose our own doctor, we could do this, so we could do a lot of things.
Mhm.
But what it did, they paid the insurance company their
Mhm.
fees, and that's why they went along with it. And now
Mhm.
this is why we're having a problem, and this is why it's good to have a person like you that know that system, because
Mhm.
all of them, they have different plans, even though they all call it Advantage.
Mhm.
They have different plans. You may have to pay, like when I go to get certain things, I have to
Mhm.
pay, still have to pay an extra fee um, um, to do things. Well, I don't want to tell them what I
Okay,
have to
right.
do.
We can. You can
So,
always call me. I
yeah,
can.
no, I will. I've told you. Since I know a little bit about this here, I will
Mhm.
call you because I don't have time to be on the phone and reading all the mess they give. I like to read little checkpoints, make it easy. And I know that you could do that for me. So, Miss Kenya, I'd be glad to call you.
Well,
But
I appreciate
it's a
it.
mess, though. I'll
Well,
tell
let's
you.
talk about it. Let's talk about it, right? Because I hear so much, and
Okay,
you
one more
know,
thing. One more thing.
sure.
The reason why, and Sandra mentioned this, that the hospital will offer you if you can't pay for it,
Mhm.
but they want all kind of information from you. And I don't like
Mhm.
people getting in my business. That's why I don't take no government.
Yes,
Um,
see,
um,
they already have your business. Let me tell you. When you sign up, you have Medicare, Social Security. They already have that
right?
information they need on you. All they want you to do is to confirm what they see. All you're doing, they're not in your business. Plus, let me tell you this that you didn't know. The money that the hospitals, when they pay that bill, that money is coming down from the federal government. They get that
Yes.
money. If they listen, no, don't say yeah. Wait. And this has been
I'll
long
go ahead. I
time.
know what you're talking about. Go
This
ahead.
this has been long standing. They've been doing this for decades. What happens when they do not spend that money on individuals to pay their bills, the hospital keeps the money. They get to keep that money. They get to keep it.
Right? I know.
So again, the money and back in the day, because you got to, we're not going to tell how old Yessie is, but
Oh, I
and
don't know.
but before, some of the people like my grandmothers, and they did not, my grandfathers, they did not have to pay some of the money that we pay out for Medicare.
Yes.
The system was different. That's why it's so confusing for some of those who came up right behind them, because that was a radical change. It was just like for VA, there were veterans who went to VA and never had to pay before they implemented that sliding scale fee or whatever they
Right.
did. And so you hear the same conversation from veterans and from people who receive Medicare about the fact that they have to pay that 20% or 10% or 15%. But there's no way of getting around paying that percentage unless you utilize that program at the hospital. And when you
Yes.
utilize that program at the hospital, I can let you know that also carries over to your clinical visits.
Right.
So you don't pay anything. So that after Medicare, whatever Medicare doesn't pay, if you don't have Part C or the Medigap, whatever Medicare doesn't pay, you won't have to pay that if you have enrolled in that program, because it's good for a year. It's good for one calendar year. So
Totally agree. I totally
do
agree.
not worry about your information, because people got your information anyway. They don't ask you what's in your bank account because it's not their business. They just want to confirm what you receive for your
From
pension
Medicare
or
or
your
pension,
social
right?
security,
Or
whatever you
Social Security,
claim.
right?
Everybody doesn't claim their pension. Some of them only say what they receive from social security, because that's the
Right.
question that is being asked. Everybody
Well,
that's
that's
talking to
good.
you, Right, like she says, keep
Right.
about integrity. Everybody that's talking to you, I've heard many of them make that mistake. They will say to
Uh,
you because they assume people don't have pensions because these younger people ain't familiar with pensions all the time, and so what they will say accidentally, oh, what do you get from Medicare? I mean, what do you get from Social Security? You say what you get
Social
from
Security,
Social
right.
Security. They say nothing else. They go on with that information. They do not come back and say, do you receive a pension or do you have any other income? They don't
Income,
ask you
right.
that.
Sandy,
And
you
so,
absolutely, thank
and,
you. You're
and
absolutely
I'm
correct.
glad, Ms. Kenyar, because I would love for you to come and speak to another group of people too, because there are a lot of our people who don't, well, white people too don't understand it, but there are a lot of
Right.
our people
Exactly. Right.
who
They
who
just
don't
love.
understand it. And depending on what Medicare specialist you get on the phone or what Social Security specialist you get on the phone, you may not get your answers thoroughly or accurately. But you should not worry about that. You're going to pay one thing, you got to get in the mindset you're going to pay 20%, 10%, or something. And that 20% sometimes is only $20. Sometimes the
Right.
20%, once you met all your other stuff, you only pay 15% because my insurance, you only pay 15% once you meet your deductible. So so I'm still gonna pay. It's never gonna be free. I'm never walking in and not have to pay something. That
Right.
doesn't exist. That does not exist.
I want
No,
to
I
just
want to thank.
interject here. So, and that's the
Go
reason
ahead.
why I lean more towards the Medicare Advantage plans, right? Because oftentimes we're not paying percentages. We're paying flat copays. So you know
Right.
exactly what you're going to be responsible
That's true.
for when you
Yeah.
go in and you're not dealing with fluctuations. Also, with the Medicare Advantage plan, they have what is called the maximum out of pocket. It's a MOOP. We would call it a MOOP or a maximum out of pocket. That's the most that you're responsible for paying while you're covered under that insurance company before the insurance company is required to cover you at 100%. With that being stated, so let me just give you a quick example. God forbid this was to happen to anyone. You have a Medicare Advantage plan, you have a slip and a fall when you get out of the tub, you actually hurt yourself, your hip, your leg, you're experiencing back pain, and they take you to the hospital. Now, the maximum out of pocket on your plan is $4,500, right? Your hospital bill after they do the labs, the x-rays, they get you all taken care of, depending on did you have to go by ambulance or were you admitted into the emergency room and then they took you to admitted you into the hospital. So all of these different things come into play, and then you get this big bill in the mail for like $15,000, and you were only in the hospital for like 5 hours, right? You would only be responsible for coming out of your pocket towards any of your health or hospital needs up to that maximum out of pocket $4,500. And then the insurance companies are responsible for covering you at 100%. So you have a safety net where you're not going to go bankrupt when you have to use your insurance for what you need to use your insurance for. And then with Medicare Advantage plans, they're going to give you things that original Medicare is just not going to give you. They're going to give you the dental. Most of them are going to offer you dental. Most of them are going to offer you vision. That's money that you're going to save in your pocket. They're going to offer you assistance with hearing aids. They also have different benefits, the over the counter benefits that'll help you with your vitamins, your supplements. They have transportation. These are benefits and features that you may need, but Medicare isn't going to do that. So you're going to pay for it out of your pocket. A Medicare, and that's again, getting the right insurance agent. vital. And I always tell people, believe it or not, I'm like, once you retire and you become Medicare, then a Medicare recipient, I am like the third highest ranking person that you should be in communication with when it comes to your health. Your doctor, your family, and then your insurance agent, all in that order: your doctor, your family, and then your insurance agent, because your insurance agent must tailor your insurance to fit your health needs. To do what? Exactly what insurance is supposed to do in the first place: save, protect your money. Protect
Yeah, but
your
Miss
money.
Kenyar,
Mm,
right. But let me tell you, this is above you. The hospital, the pharmaceuticals, all of
mm,
them is in bed with each other. Okay, it's so
mm,
much fraud going on out here. I mean, billions of dollars, if not a trillion. Okay, that's why they just had to lower pharmaceutical costs
right,
because
$2,100.
we were paying more over in England
Mm,
and Canada and those other countries was paying $15 for it. They charging us 30, 40, and hundreds of dollars for medication.
mm,
Okay,
mm,
then the doctors, the primary care doctor to the specialist, should they
mm.
have you coming back? My doctor used to say, I fired him. He had
Oh.
me coming back every time I came there. He wanted to get some more blood. More blood. Shit, I said, man, can you take all this at one time? But let me tell you what I done. Then
Mhm,
every time he referred me to somebody, I had to pay a co-cost, even to go and see him,
mhm,
35, 25. Well, what I did, I went and I joined like Shands. I think she said she get all her stuff done at Northwestern University. Well, I
mhm,
go to the University of Illinois and I brought
mhm.
all my primary care, all my doctors that I need to see. I brought it there, and it helped
Mhm.
cut my cost almost 200, well, $200 to $300
That's
in going
good.
to see them every 3 months or whenever I need to see them. But I know that I save money that way. But they're committing fraud out here. My doctor sent me,
Mhm,
and then up the doses. And then he finally sent me to a specialist
mhm,
in it. And I asked the specialist, how did this happen? And you know what he told me? You waited
mhm,
too long. Which means my
mm,
doctor was feeding me with pills when he should have
mhm,
took me to see a urologist.
mm.
And I like,
And
man.
let me tell you, they have implemented something pertaining to that. And that's why it is very important that you guys get your preventative care screenings, testings, and things like that. Because now it hasn't become the most popular thing yet,
Right.
but now doctors, if you have a patient and then they come up or they are diagnosed with a chronic condition and they were under your care, then you may not your pay is gonna get cut because you're supposed to have caught that. So if you could see, if you notice, a lot of times now the doctors are not sending in their nurse practitioners to take care of you guys. They're actually coming in and spending time with you guys because those are some of the new things that are going on behind the scenes.
Miss Kenya, let me respond to that. I
Mhm.
enjoyed seeing the nurse practitioner better than I like seeing the doctor. Because you could talk to them, they answer questions, then questions they can't answer. They say you got to see the doctor on that. Yeah,
Mhm.
I went and
Mhm.
the doctor sent me to a specialist, and the
Mhm.
specialist came back and I asked him, whether I'm on my chart or whatever,
Mhm.
and I see all my tests that come back, and I
Mhm.
go and ask my primary care doctor, well, what do this say? What do this say? Because it says that normal, not off, that's off a little. And I would ask him, he said, well, you have to ask the one that gave you the test.
Mhm.
I, this is what he told me, and I fired him. I said, I ain't got time for this. And I'm one that like to talk, and like to know
Mhm.
people. So,
Interact.
but
Yeah, you're very personable.
Yes, I'm very personable. Most people don't like that in me, though. But, you know, like,
It
I live
is
with
what
it.
it
You know.
is,
Uh,
right?
yeah. But no, I'll be
Oh,
calling you. You know, as soon as my stuff is up, I'll be calling. You know, in October. You know,
Okay.
you be hearing from me. But I'm gonna go back. Let me tell
Okay, hold
you.
on. Let me just
Okay, go ahead.
intercept and
Yeah,
let
go
you
ahead.
guys know that I have put my direct phone number in the chat. So if you want to write it down, save it, and you don't have to wait till October to call me. Let's say you have a question, or you have a friend, or you saw a commercial, or someone told you. If I'm going to be your insurance agent, I need you to call me and let's talk about it. Let's find out if the information is accurate.
I'll get your number from Wanda.
Le-
Okay.
It's in the chat. Write it
I
down.
don't look. I am not
yeah,
computer
get
literate.
it from
Look,
one.
I be at my
All
phone
right, get it from
right.
Wanda. Get
Get
it
it from
from
Wanda,
Wanda.
right?
Yes,
Okay,
sir.
shit. I
Mhm.
had to text her and say how I get on this show.
Uh, okay, and we have another insurance agent on the line. Miss Margot Richmond is on. Margot, introduce yourself.
My name is Margot Richmond, but I retired from the insurance industry last month. So,
Okay.
but I was a life agent. I didn't do hospital. I didn't do medical. I just
Okay.
did straight over.
Straight life. Wow. Whole
Yep.
totally different beast.
But why you quit?
Although I had all right. First of all, I retired. I didn't want to do it anymore.
Mm. Okay, you said you quit. You retired then. I'm just okay.
I quit too. You know, I did either one you want to say. That's what I did. I got tired. You know, but I had health license, but I never did health. I worked over 40 years in the medical field in the hospitals and in clinics.
Mm-hmm.
So I would have had to specialize in that because it's too critical. People's lives and medical and doctors
Mm-hmm.
and the way they have to change it, I would have had to just specialize and do nothing but health.
Right.
So, and
Right.
after the HMOs came through, I pulled back. And when I got ready to take the exam, I took the exam, passed the exam, it's on my license. I just
Mm-hmm.
decided not to. I just decided not to do health.
Yeah, it is. And
People
that's
count on you.
that.
People count on you to give them the right information. And since I've been sitting here listening to you, I want to commend you. Uh, they give the people information, and then when they get there, something totally different. That's the lifeline of somebody, you
Mm-hmm.
know. So I just didn't want to take them chances. You know, they don't like switching their regular medical doctors, and then when they brought in nurse practitioners, it was a bit much for me. So I
Yeah, the
wouldn't.
nurse practitioners it's a lot here, and this. I guess this is the like I was saying before. For me, for me, the when I what motivated me, and I'll be transparent with you guys. What motivated me to get into insurance was because someone told me that I would never be an agent. I would never be an agent, right? So that challenged me. However, what kept me into the insurance industry, especially in the health field, is when you do help, like that's how I met Miss Carter. When you are able to actually help someone and they are enthusiastic about it. Someone had enrolled her in a plan that her doctor didn't accept.
Yep. Yep.
And when you have a relationship, to us, it's like, oh, you have a PPO. You can use doctors that are in or out of the network, right? And that's true. You have a PPO. You can use doctors that are in or out of the network. However, there are some caveats to that. One, you may have to pay more to see them because they're outside of the network. And the most important thing is number two. Just because you have a PPO does not mean that they have to accept it.
I know. Yeah.
Just because,
I,
yeah,
So
say
when
insurance, period, they don't have to accept it because that's on a lot of the paperwork. I think people misread or overlook that when you first go to that doctor's office and you sign up, or when you're at the hospital, when you're
Mhm.
signing that treatment form, they let you know that if it doesn't matter whether you have insurance or not. They don't
Mm,
have to accept your insurance, and I think a lot of people don't read that.
mm,
And again, they get kind of scammed, because I know two people had some weird insurance, never heard of them. Because
mm,
like you said, there are a lot of people that are not that operate without integrity out there. And when they were being treated here, the problem is that here in Illinois, that insurance isn't accepted anywhere here in Illinois.
mm.
And yet both of those people are residents here, and they have them through their jobs. And
Wow.
right, and they've both gone for treatment, and none of the places accept the insurance, so they've had to pay full
Out of
price.
pocket.
Yes, ma'am. Yes, ma'am.
See,
There's a lot of scams going on out there.
It's called a racket.
and that
This
and
ain't
that's the
no
Right.
reason
scam, it's a
again.
racket. I don't know why most of y'all don't become whistleblowers. Okay.
A
And
lot of
yeah,
people, but that's what I'm saying. You guys do have rights, and you
Yeah.
can make your complaints. But the most important thing is the best advice that I can give anyone is when you find that insurance agent that you click with, that you keep that insurance agent for as long as you can keep them. They've already made their money when they enrolled you the first time. Okay. So it's not like it's a money thing. You want to keep someone that you know that really actually cares about you. I'll share this with you guys, and then I do have to drop off. But my my uncle had two strokes recently. We're trying to set up a home health aid, but his information is completely wrong. So they won't accept it. So how does he have a health insurance, but his Medicare information in the system is inaccurate? Does that make sense? Medicare, when whoever submitted that application, when they submitted that application, it automatically goes over to CMS for approval. CMS is looking for accurate information to confirm that this is the right person, the right Medicare ID number, and then they're going to confirm that the SEP or the enrollment period is an actual enrollment period, and then they'll approve the application. So they'll approve it or deny it. Now, how was his insurance has been active for the longest? So how's the information not accurate so that he can be able to use the services that he needs to use now? Some people just call for the food card or a benefit, the OTC benefit. And people, insurance agents will run off on that, right? You want a food card? We'll give you a food card. We ain't talking about doctors. We ain't talking about nothing else because this is what you called and this is what you said that you want. However, again, there are other insurance agents and insurance companies that require that you take your time on that phone, Mr. Jesse. I know you don't want to hear all the rigmarole,
it's
but
a
that
racket,
phone call might
Miss
be
Kenyar.
45 minutes to an hour to get the work done properly. But it's worth it because your life depends on it.
That is so
Look,
true. Say that again. That's why I said you need to say this to a lot of people. They think a 15-minute or 20-minute call is excessive, and they don't want to hear anymore. Like you said,
Mm-hmm.
to fully understand and make sure they have enrolled you properly, they have
Mm-hmm.
your information properly, it may take you an hour for you to make sure you understand what you're getting, even if you have so much knowledge, because as you said, Medicare is more intense than what people think. Because even if Medicare Part A, that's the thing I was going to tell you. I don't know if you were aware. For federal employees, when we retire, we're automatically enrolled in Medicare. For those people who come out of private sector, and some of them they said the state and the county too, if you enroll too late into Medicare, you pay a penalty, and you pay that penalty forever. Some of them are saying, for
Yeah, there's that's
and that's another thing I think of. I've heard of two people who got
mm-hmm.
stuck with that, who because and they came from. I want to say one said she came from Sears, if I remember correctly, and another one came from another big organization. I want to say maybe Kraft Foods. And for some reason, the person at Kraft, I know she kept her insurance,
Mm-hmm.
but she felt because she kept her insurance, she didn't have to do Medicare. And that is not true. You have to at least do the enrollment for the Part A to do whatever they do. And
Mm-hmm.
she has been socked with a penalty that she is fighting and has been fighting for the last 3 years. And that is
Is it for her?
crazy.
Now, oftentimes I hear now. I hear about if you don't have credible coverage for the Part B, then you're talking about a late enrollment penalty, and this is another very important thing, Part D will give, if you don't enroll in Part D, your prescription coverage. Say you're like, oh, I don't even take medication. I don't need a prescription plan. Yes, you do.
Yep. You got to tell them that. Yes, they do. Yep.
Yes, you do. Well, why do I need a prescription plan? Because right now you may not be taking any. It's first, it's federally required, but
Okay.
right now you're not taking any prescriptions. However, when you do need your prescription coverage, God forbid you have to get like a tier 3, one of those brand name prescriptions or a specialty prescription for like cancer or something like that, or kidney disease. You're going to have, when you do get that prescription coverage, you're going to incur a lifetime penalty unless, see, this is where your insurance agent comes in at.
Look,
There
Miss
is a
Kenya,
way.
you got to go, Miss Kenya. But let me just, before you leave, let me tell you.
Okay, all
I keep
right.
telling y'all it's a racket. Okay,
Okay.
pensions and Social Security. When Social Security started, there was 28 people working to one person that was on Social Security. The other thing, by 1968, there was only 14 people working. Now you got about 5 to 7 people working to pay for Social Security. So they already know it's going bankrupt. On the
Mm-hmm.
pension plan, government is the biggest employees in the world, okay? And
Mm-hmm.
pension, like Illinois is going broke, California is going broke, Minnesota is going broke. All kind of states are going broke. The Michigan, Detroit already went broke with pension plan because here if you join in the pension, working for government, you putting $5,000 to $7,000 a year into your pension plan.
But you know,
Okay,
automotive companies have pensions.
say that
Well,
again.
Kraft has pension. All big
I
industries
know
have
they do.
pensions, not just the government. All those big industries
Look,
have pensions.
it's the government that pension.
Airlines have pensions.
I know that. Let me finish, Sandra. Okay, okay. Let me tell you why the government pension is going broke. Okay, because
The
you
government
all
pensions ain't broke.
look. You don't go and look at the Illinois pension.
I just
Listen,
did. I just finished doing the
listen to
whole thing
me.
with Pritzker. I just finished.
65% of the teacher's pension, money of school budget, 65% of it goes to pensions. Okay, 35% goes into the classroom. That's going on everywhere. Okay,
That ain't broke.
we need to quit arguing back and forth, and we need to go and read. They got all this reports out. This is what the Department of Health, Robert Kennedy, is talking about. The pharmaceuticals, the pesticide, and all this stuff. We obese, we unhealthy.
But we just talking about Medicare right now, yes.
Right, Medicare is going. Look,
Well, yeah,
let me
yes,
tell
we
you.
just want to we
Let
want
me
to
tell
make
you.
sure people get
Let
what
me
they
tell you
need. Yes.
about Medicare. That's why I just said it's a racket. We
No,
paying
no,
more.
dear heart, it's not a racket. I promise you, it ain't a racket. And
Okay,
like she say,
okay,
it's required
yeah.
by Republicans, Democrats, and
I don't. That
independents
don't mean it ain't a
that
racket.
you that you apply. And don't know nobody,
Yeah. Okay.
even
All
the
right.
congressmen, they gotta apply. It is no
Okay.
exception to the policy.
I didn't say that they didn't have to apply. I just said it's a racket. Okay. That's all I'm saying. People can't afford it.
Well,
Okay. That's why
But
they
no, what
own
you can't
it.
afford is to get sick and don't have any kind of insurance. That's what you can't afford.
Look, let me tell you, okay, that's 30 years ago. Okay, we had county hospital, we had all kind of different, you had places to
County
go.
bills people every day, sir. County send out bills quicker than Northwestern
Yeah,
does.
right,
And if you
I
think
know.
they don't,
We're
go
talking
ahead.
about cost, okay? The reason why the stuff is so high is because the value of the dollar is nothing. I know the whole story, Sandra,
But right
okay?
now we're just talking about
Okay,
Medicaid.
ladies and
That's what
gentlemen,
I'm talking about. But
we
anyway,
Kenyar,
I'm
it's
still
been
talking about it,
wonderful. You've
okay?
been
we
wonderful,
we
Kenyar.
have a guest. We have a guest that is the keynote speaker. So let's
She
let
said she had to leave. I just made a statement, okay? And then I was going to end it, okay? But I
okay.
told her I'm going to call her when I need to deal with it.
There
But
you go.
I just want you to know that I
I
understand
got
all
a
this stuff
question
that's
for
going
you
on.
guys. Can I come back and talk with you guys
Please do.
again?
Please do. But I mean, no, I don't have any control over it, but please do.
Okay, and Miss Lockett, I did take down your number. Is it okay if I reach out to you about your playwright?
Oh, definitely. I think she's doing something, but I'll speak for her. Sure, you
Okay.
can. I
Okay,
was on. I was
awesome.
on the
And
call.
that
I
is
heard.
true.
There you
Yeah,
go.
I'm listening, and yes, she was correct. Yes, you can.
Okay. And I don't know, you speak so you're a great speaker, Miss Sandra Campbell. I don't know why I want to call you a doctor.
Please
Maybe it's
don't.
the
Please don't.
right, maybe it's the position, but of your image. But yeah, so I would love to speak with other individuals if you would
Oh,
like me to.
I will definitely be reaching out to them after we get off the phone because I can tell you there are many, 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 many people. We've had this conversation in passing, and even though it's just a group, we've had this conversation about the differences. And again, everybody's saying, depending on who you get information from, some of it is accurate, some of it, and then we're
Sandra,
all
you
in
done
different,
said that the woman
we're in
got to
different
go,
systems and
okay?
all kinds of
Gosh.
stuff. So yeah, I would
All
definitely reach
right,
out to
Miss
them.
Carter, I'm gonna reach out to you a little later on, okay?
Thank you. And thank you very much for joining us on this session. And ladies and gentlemen, we're going to end this show.
Well,
I
take
thought it was
good
over at
night.
8:30.
No, it's over at 8.
Oh, okay. Well, on the thing, I said 8:30 what you said. Okay.
All right.
All
Thank
right,
Good night,
you.
everyone.
everyone. Enjoy yourselves.
Thank you.
Good
Stay
night.
cool.